PRP, if we need it, we will use it for like hair, we'll use it for joints, we'll use it when we're like stimulating a little bit more skin quality, darkness, hues around the eyes. Those are great areas for use PRP. And now with more research and all these amazing things, we're starting to talk more other things such as PRP. It's a little bit on the for me at least, I'm always trying to shoot forward and look for the newest, latest, greatest things.
I appreciate you not looking at me when you were talking about like the loose spanks. Because I feel like normally you would. Okay, let me tell you guys, a day in the life of working with Dr. Bach, although we don't see him as much, these are good stories. We don't see him as much anymore because he's out in West Hollywood. So if you guys are in Rico and you want somebody, I saw someone asking to trust, they need someone to trust with their forehead. This is the guy. But we're walking through the office and he's like, hey, have you ever thought about, no, I didn't, until you just brought it up. I said, thank you, sir. But he just always wants to make sure that we are at our best. But loose spanks, I know, Thanksgiving meal, loose spanks, I just appreciate you not looking at me.
You're very welcome. You're very welcome.
But yeah, so we are going to jump to M-Sculpt, you guys. If you're looking for muscle tone, abs,
butts,
biceps.
Oh yeah, biceps.
Okay. Always protected with the guns with Dr. Antonino. So follow us on over there. We're going to do with Victoria and then we're going to left. Who's Tanner?
So yeah, you guys, they're doing all the skin perfect stuff. I'm in Costa Mesa, and so they're answering all the questions about procedures because you guys know I'm partners with them for the one in Rancho. I'm in Costa Mesa right now. So, I don't know where to sit this at. Oops, there we go. But yeah, you guys, so let me make sure.
You're going live?
I just went on there.
Hi. How's everybody going?
So what do you guys do here at this branch?
This branch we do everything that we do at Rancho too.
Yeah?
Yeah, it's our OC.
So nice, you guys.
I know, it's a big location and we're here to service all, right?
Yeah.
We're all over LA.
You guys are always asking me about my face. Some of them think I do a little bit too much, but can you explain how procedures are, especially temporary ones?
I mean, ultimately, everything that we're doing is about prevention. You know, we're gonna lose volume, and when we're doing anatomic studies, we actually notice that we're losing bone structure, we lose fat, our skin ages, and so we've noticed that if we add up how much we're losing about 3 to 5 cc's, so 3 to 5 syringes per year of life.
Wow.
Starting at the age of 30. So imagine a patient comes to me at 40 and they want one syringe to fix their whole face. It doesn't work. I mean, you got to start earlier in life. I tell people it's like going to the gas station saying, you know, my tank needs 20 gallons of gas, but I only got 1 gallon of gas. You're not going to get the mileage. And so it's about finding the person.
Jahoon, hi Jahoon.
It's about finding, honestly, people who are going to understand your aesthetic look. At the end of the day, I think people have to get over the fact that you're paying for a syringe or you're paying for that product and realize that this industry is about the artistry. What you're paying for is the artistry. It's kind of going to your hairstylist. They have the same scissors, they have the same extensions, yet you're still going to pay $300, $400, $500 to go see that hairstylist because they understand what's going to work for you. And I think this industry has to get back to that, and patients have to understand that a lot of us as practitioners spend a lot of time educating ourselves on our own time, really upping our game so we can bring the best to our patients. And so that's kind of what
this is all about prevention, you guys. Oh, somebody said something else. I'm missing the comments, but yeah, it's all about prevention. A lot of people think I'm doing a lot. They say, and some of the comments, they say, oh, you're doing a lot. Usually they come on a little later. I'm coming on kind of early, but they said I had the nose threads, I had the eye threads, and I also had microneedling. And
so microneedling is different. Microneedling is going to stimulate collagen. So it's about collagen induction therapy. We actually know that our skin starts to produce 1% less collagen per year of life starting at the age of 25 or 20. So if you are slowing down as far as producing collagen, By the time you reach 30, 40, now you're 10, 20% less producing. Because we're producing collagen all the time. So that's
Right.
how your skin gets more sallow. You lose that glow. Because if you lose the collagen structure in your face, you lose the hyaluronic acid, so that dewiness that you all love to see,
Yes.
that you try and make with your makeup,
Right.
you can get that naturally. Like, I don't do anything. I don't
And
put
your
makeup
face looks
on.
good. Look at his face. It's so nice.
I just do my lasers. It's about
Right.
stimulating collagen, getting that up to speed, and when it's looking good, it holds on to that water, it holds on to everything, right? And
So what is the best beginner-friendly procedures? Because a lot of people ask me about the beginner-friendly.
I mean, the beginner-friendly procedures, that's going to be hard because ultimately it comes down to, are you looking at your skin or are you looking at volume replacement? Because some
Right.
people genetically, you lose under eyes.
Yeah,
and,
me.
you know.
Me genetically, for sure.
And so genetically, it just comes down to what you're missing. You know,
Right.
people want lips, they want a little enhancement. I think it really depends on your age group. Skin is always one that I think, as I'm getting older, that you realize you need to start taking care of earlier. So
Right.
while you're starting your microneedlings earlier, it's not like you're overdoing it. You're stimulating that collagen. It's kind of like
Right.
working out. You're working out your skin so it
guys
will
get
get
that?
healthier
Right.
so that when you turn 50, 60, 70 years old, you're going to have skin like this.
Yes. That's
Because-
what we're trying to do. That's what we want.
I mean, that's what you're working about, and
Yeah.
people don't realize it because they're like, You're starting too early. You're starting too early." And I'm like, it's kind of like having a car. If you start earlier to take care of it, you wax it, you do everything, and you make sure it looks good.
Yeah.
It'll last you 10 years down the road. Your car looks brand new.
Right.
I mean, you
Right.
don't complain about it,
Yeah.
but it's about the prevention.
Right.
You don't do anything to it. You come at the end of 5 years and your car's smoking, and you're going, well, I only have $1,000 to fix my car.
Yeah.
It don't work.
Yeah. Facts. Facts. It's not gonna work.
It don't work. And so if you have the ability to start a little bit earlier, just doing little things like microneedling,
Right.
microneedling radiofrequency, those type of little things that stimulate collagen, and then occasionally a little bit of Botox just to relax out. We're expressive people,
Right.
and if you can just slow down that muscle, it doesn't need to be often. I tell my patients that have deep lines and wrinkles, I need to see you every 3 months. 3 months until the line is gone.
Until
If
the
you're
line.
starting earlier before you get a line and wrinkle, I need to see you once a year.
Yeah, you guys got to start. This is prevention. None of this is like a permanent surgery. You guys act like I'm getting surgery every single time I do this, but it's not. So,
And,
he
and
just,
things like that, things like microneedling radiofrequency or microneedling, things like that, you have to realize when you get a facelift, all they're doing is pulling your skin back. They're not changing the quality of your skin.
Right.
That's why they have to do like a CO2 laser. They do something more invasive to actually try to stimulate your collagen. But if you're getting stuff like that done, when you get your blef, when you get your facelift, your skin quality is going to be so much nicer that you're going to heal up nicer and you're going to get so much better results.
Right.
People don't realize that. That's why
Yes.
I'm not against sending people to plastic surgery. If they need it, they may come in and they're too loose. But let's start priming the skin so when you get the surgery, your skin has the tenacity to look really good after
Right.
it gets it.
so if you're like 60 years old and you kind of have a lot of saggage, is it better just to have surgery or just to do procedures?
If you're not in a rush, doing a little bit of microneedling, priming your skin up is going to set yourself up nicer so that when they do the surgery, your skin's going to be thicker, it's going to be healthier, so it's going to heal up faster. But you could always wait until you get the plastic surgery and then come in and start that process.
Right. So you guys, some of the 60-year-olds that's on here that's saying that they can't get nothing done, you heard
Start
what you
doing
said.
it,
Yeah.
Start doing something that's affordable. Change the skin quality, and then
Right.
slowly save up for your facelift.
And for all those people that said that the threads, they've been saying a lot of stuff about the threads. Basically, I got so many comments saying that the threads are dangerous.
You're always going to hear that. I mean,
So-
it comes from the plastic surgery world, and there is credibility because when they first got started in the thread industry, they were non-dissolvable, so they were permanent, and so they had a lot of complications. So if the plastic surgeons grew up in that time frame, they have a bad rap with regards to
Right.
the threads. Nowadays, these are dissolvable. They dissolve within 6 to 12 months. They're stimulating collagen while they're in there, and so you're going to get nice treatments. A lot of things, people say, oh, it damages the skin, it damages it. Well, anything we do damages it. If
Mm-hmm.
we do other things like even a facelift, if you did a facelift, you're going to create all the scar tissue in there, and they're saying threads create scar tissue.
Yeah.
You do one facelift, you're going to create all the scar tissue. The plastic surgeon is not going to deny you if you want to do a second. And that
Right.
creates even more scar tissue than
Right.
1 or 2, 3 little threads.
Yeah.
So, that damage and that scar tissue that you create from threads, maybe in like 4 or 5 years, it's gone.
Right.
So, you're stimulating collagen with these threads, and they're there to hold you back into place, which is part of the aging process.
And it creates collagen, right?
Yes.
So that's why I'm doing those things.
Yeah, threads really are not bad for you.
Right.
If done incorrectly, yes, you can have bad results, and that unfortunately some plastic surgeons are going to see the bad results
Right.
because they're going to see injectors who are not properly trained do it. Threads have a bad rap because it is still Wild Wild West. You
Right.
still need to find people who are well trained and know how to do it properly.
And so with this facility, they are well trained. A lot of people said, you need to go to a doctor and not.
We are doctors here.
He said, great info. Hi,
Good.
hi, Miss Titia. Sorry, I can't even see. But yeah, they said that you could get bacteria in your head, and
If it's not clean. If you're doing a filler, you're doing Botox, and you can get bacteria. You're using a needle to put in products.
hi,
So
Kanaya.
it really just depends on who's doing it. At the
Right.
end of the day, that's the artistry. Choose people wisely. Make sure they're getting educated properly.
Hi, Joan.
Ask them about their training. How much have they done?
Right.
Make sure that you're comfortable with it. Here I do a lot of training for internationally and nationally for threads, fillers, all of that stuff.
Right.
So all of our staff are well trained. to
And
be
you're
able
like
to
the
do it.
president of all this, aren't you? Like he's the man, he's the big dog here.
I kind of am.
yeah.
I've been doing this for 17 years.
See, this is why I came to them. Even before I started, being partners with them for YouTube, I was already coming to this facility, not this one, but in Rancho. So I do trust them a lot. So I don't know why you guys are saying I need doctors to be doing this, but they are actually certified.
And that's the one big thing. It's not nothing against plastic surgeons and dermatologists and doctors, but you guys have to understand. Like you go to a plastic
Nikki.
surgeon, the plastic surgeon's expertise is plastic surgery.
Right.
It's not threads. It's not even fillers. It's not even Botox. Because honestly, they make more money doing surgery. So
Right.
why would they spend their time doing it? If you
That's
go to
exactly
the
what I
plastic
said.
surgeon's office, they're gonna send you to see their PA. They're gonna send you to see their nurse practitioner or their nurse.
Right.
So at the end of the day, honestly, there are great plastic surgeons that do great injections, but a majority of them that I've gone out to the offices and trained, they don't spend time wanting to train themselves on
Right.
that stuff. They'll send their nurse practitioner and their PA and RN in to
Right.
get trained. And there's nothing against that. So you guys have to realize dermatologists, plastic surgeons, everybody comes out at the same playing field.
Right,
There is
man.
no residency, there is no training for this stuff
Right.
in medicine.
Right.
Dermatologists are the study of skin diseases, not the beauty. There is a fellowship in lasers, but the actual aesthetic medicine of injection, they have to learn it on their own after they graduate.
So you getting all this tea? This is why we go to these facilities, the medical spas and stuff like that. It's not surgery. You guys think that I'm just taking off my nose and putting on a different nose. Like, it's just like, why are you doing that? You're black. Don't do that. That's you messing up your features.
No, I have a lot of black patients.
Yeah.
And the nose threads on blacks,
Yeah.
so good. 'Cause
Exactly.
I used to do a lot of fillers on noses on blacks, and it looked okay, but it was still a little fluffy, but threads, ooh.
Jeannie said, you're speaking facts.
Oh, I try. I try to be honest with people
Yeah.
about all that stuff because I've been doing this too long.
Yeah, and they have so many concerns, and you guys know that I get a lot of views on the medical stuff, and sometimes I don't know how to answer some of them because it is medical things. So he's right here. You guys can ask him what you want.
Yeah.
Anything that you guys want to ask him.
We are hanging out.
Yeah. In Costa Mesa, you guys. So if you guys, it says that's the perfect verbiage. Check people. Dermatologist is the study of skin disease, not the beauty aspect.
Yeah. I mean, even plastic surgeons, they do great in plastic surgery. You want to choose somebody, if you want to do injections or you want to do threads, you want to make sure that they do that every day. You know, if you're a cook, you cook that food. If you're cooking French food, you're not going to cook Chinese food very well.
Right.
Sorry.
Right.
You know, this is where if you're doing this every single day, you're going to be the expert. Just because you have something behind your name, doesn't really mean anything this day in medicine, because there's so many sub specialties within it. It doesn't mean that you are really good at what you do unless you really do that every day. Plastic surgeons do plastic surgery every day.
Basically, you guys. Just because they have a PhD in something doesn't mean they're experts in every single field.
And same with plastic surgeons. You know, there are ones that do great boobs, and they're known for their boobs, and there are ones that do great noses, and they're known for their noses. So you're not going to go to a plastic surgeon who does all body for your face.
Right. That'd be a disaster.
I mean, disaster, exactly. So this is where you have to understand every field has their experts, and you just need to make sure that you're looking for the experts.
Right. They said preach. And it said period.
And it's not just doctors that are great. I train a lot of people, and sometimes the nurses that are out there do way better than the doctors. So ultimately,
They're calling for you.
I gotta go. We're doing a virtual over there. But if you guys have any questions, let us know.
Yes, they're doing a virtual. You guys can actually check it out on skinperfect.com. And if you guys want to RSVP, you can see some of their live virtuals right now.
We're doing
Right?
some injections.
Yeah, some injections, all kind of stuff.
Yep.
I've been seeing something I already want. I already want the jawline. So if you guys mad at me about the other stuff, you guys gonna be mad at me now.
Bye guys.
Bye.
We'll see you later.
See you later. But yeah, you guys, so this is what I just wanted to clear that up, because some of you guys are just saying like, I'm doing too much. All of this is prevention, you know, and yeah, so that's why I'm glad that he came. He's like the president of everything. Everybody's board certified here, and this is Costa Mesa. He's also at Rancho. They're doing a whole virtual setup here. So I just wanted him to clear up some things. Did you, Mary? Oh yes, I love it, because right here it's getting a little soft. I've been noticing that. And usually I have a very strong jawline, and it's been getting a little soft. So I've been wanting to get that done. So hopefully that's the next procedure that I get done. I don't know. I've been feeling the procedures I've been getting done, because I feel really good about myself. Like, I feel like it's definitely adds balance to the face for sure. And that's what I want to do. I want to add some balance to my face. You guys know I'm a model, so that's very important, to keep that balance and to keep the youthful look. It's very, very important. So the threads, microneedling is all preventative actions for the skin. Don't mind my baby hairs, just keep curling up like all crazy. But yeah, so I just wanted to come on and, you know, talk to you guys and give you guys some more facts, because I get a lot of like low-key hate messages about what I'm doing and false facts. I don't have nothing against it. I'm just afraid of needles. Girl, I'm afraid of needles too. Oh my gosh, if you guys don't know, I am very, very afraid of needles. I actually was kicked out of Kaiser because of an incident when I was a little bit younger, and I couldn't go to Kaiser for a long time because of a needle incident. So I'm very, very like afraid of needles. I just kind of got over it a little bit as I got older, like 25-ish. You know what I'm saying? That's when I started feeling like, okay, I'm not gonna be as afraid, because it was getting kind of old for me to be afraid of needles. So yeah, I highly recommend Skin Perfect, because I don't let nobody else touch me as far as like procedures, because I know for a fact that they're board certified. I was the same person that was recommending the rhino doctors. I'm with you on the beauty treatments. Yes, I still want to get, like, I kind of still want to get rhinoplasty, but I'm kind of happy with the results that I can get with the needles and like the fillers and the threads. I'm kind of happy with that. So I don't want to change myself so much to where I can't recognize myself. That's not what I'm trying to do. I'm just trying to do preventative actions that can make me look a little bit better than I look and make me stay youthful and stuff like that. So that's all that is. I'm not trying to change me. I don't hate myself. I get a lot of those comments a lot. Oh, you hate yourself. Oh, you hate this. And, you know, you guys want to see the doctor that does my threads and stuff? Because she's here. You guys want to see her? Here she is. Okay, right? Keep it as natural as possible. Yes, that's exactly what I'm trying to do. I'm not trying to change my features and just be a totally different person. That's not what I'm trying to do. I'm just trying to look more beautiful as myself, but you know, a little bit more enhanced, just like anybody else. I feel like, you know, just the same way with people that want straight teeth. My teeth are naturally straight, but there's somebody who might have some messed up teeth that wants to put braces on their teeth to make their look better. It's kind of like the same thing. A lot of BWs do get, black women get these treatments. We just keep it a secret, yeah. And that's the thing, I didn't want to keep it a secret, and it was so like, a lot of people was coming to me like, oh, I'm so happy for these videos, you know. Why do I keep missing y'all comments? Oh, I can't see them sometimes. Like I can see them for a few seconds and then they go away. But yeah, it seems like black women have to kind of keep it a secret because they'll be attacked for saying, look, I just want to do this to myself. It doesn't mean we hate ourselves. It doesn't mean we hate our features. And it also doesn't mean just because a person have a more narrow nose that they're not black. My mother has a straight nose. You should start doing consultations. I've known you forever and you still look the same. Yes, Tanaya, thank you. I'm glad you said that. She's known me. This is somebody who's known me since I was a teenager. And it's just crazy how people say, oh, you hate yourself. You don't want to be black. You wear weaves. I wear weaves because it's easy to do my hair. I don't want to spend like a whole freaking hour doing my hair, doing blowouts and stuff like that. Just put on a wig or something. That's how I think. I just think of the fast way to make myself look the way I want to look and get out there and do what I do. You guys want to see the nurse practitioner that normally does all my threads? Say hi, you guys. She's the one who's always doing my threads. And she did my nose, my threads, and you guys are always asking questions about her. And she's right here. Do you guys have any questions for her while she's right here? They take a minute. It says they don't know how much hair you got under there. Because I was talking about weaves.
I got it.
But yeah, she's right here, you guys. Anything you guys have to ask, all the questions that you got on those videos, she's right here. So if you guys have anything that you guys want to ask me, and then I'll get the answer right here. They normally take a minute. I'll probably come back to you just in case.
I'm staying right.
Okay, she's gonna be right here. So when you guys start asking questions about anything, she can answer everything you need to know. Anything you guys ask me every time I get off a live. Are fillers the best hyperpigmentation under the eyes?
I'm sorry, what was the question?
It says, are fillers the best hyperpigmentation under the eyes?
For hyperpigmentation under the eyes, fillers are not always the go-to. Mm-hmm. It's good if they're actually hollow. So if you're hollow and that's the reason it looks dark, then fillers are the way to go. If, however, it's actually pigment that's the problem, then we want to do either a bleaching agent like a hydroquinone, or we want to do PRP, which will actually lighten the tissue.
Okay. And then one of them said that they're considering getting fillers in the cheeks, but they feel like it's going to make their nose bigger.
No, not at all. No, that it has nothing to do. When you do actually put a little more into the cheeks, it gives you more of an upside down triangle, which is ideally what we're trying to accomplish with the female face.
Right. Mm-hmm. And I got my cheeks done, you guys. You remember that video that you guys was telling me, don't do that, don't do that. I got them done. Is PRP a one-time treatment or a series?
Typically, it's a series of 3 treatments in order to really see an improvement in the skin quality and in the pigmentation.
Okay. So any more questions, you guys? I know I'm super tall. I'm 5'8". The thicker the filler usually doesn't do a lot of, what is it, migrating?
So it's more about product placement than actually the thickness of the product as far as migration. So if your provider knows what they're doing and the placement is correct, there shouldn't be migration of your product.
Okay, you guys got that? I can't repeat none of that. So you guys don't have to play it back. So if they have any more questions, never bone, it says never bone? Oh, near bone. Near bone?
Near bone, yes. So ideally, you do want to go down to bone. If you're near the periosteum, you're going to have less migration. However, there are some thinner fillers available now on the market that you can be more superficial. But again, it depends on the injector's technique.
Okay, you guys. I'm about to get off alive in a minute, so if you guys want to have any more questions, you got all the experts here. You guys give me like 50 questions a day almost, and I cannot answer hardly any of them. So they're here. So if you guys have any more questions before I get off alive, I'll be on for 4 more minutes until like 30 minutes. So let me know, because she's here, and I don't want to keep her standing up, so. It says, does threading is being done, can it cause keloids? Oh, no problem, inspiring. It's somebody who said thank you.
Okay. No, the thread should not cause any keloid formation. We're going in deep into the tissue. There should be no concern for keloids.
Okay. So even if they're like keloid prone, can they still be?
So normally, for example, we have one entry point. So only at the entry point, if there was any keloid, it would be just there, because that's the only area that we truly traumatize that's close to the surface. If that were to happen, then we would have to just inject it with steroids in order to flatten out the keloid. But I have never seen it.
And then they had some questions about, because I told them that one of my threads popped, because it did, I just didn't tell you. I accidentally popped it, because I was, doing something too strenuous on the side, and I kind of hurt it just a little bit. But I still think my eyes look good.
So really, it doesn't pop and completely release.
Yeah.
It just releases it a little bit. So for example, if someone has bronchitis or starts to have allergies or something that really pulls on the tissue, you might see like it tears or you feel like it releases, but it's just a small, minute amount.
Yeah, because my eyes still look similar.
Yes. We could always add a thread if something really happened where it released it completely. We could add another, but there's so many barbs on there that it's, even if 1 or 2 release, there's still sufficient there that you're not going to completely drop.
Right, because my eyes still look really good and intact. But I felt, remember when you asked me, did any of them pop? And then right when I got home, I popped it like 6 hours later. I was like, I think I was yawning really, really hard. And then I felt like a
little pull.
Yeah.
Yes, and you can sometimes
the
hear it.
noise. Yeah.
But again, there's so many barbs on there that only 1 or 2 release, but the rest of them are still holding on, so you don't actually see a change in the tissue.
Right. And one thing about the eye threads, I feel like it's so much more firmer right here. Like, I feel like it just made my skin better.
Yes.
Like, it was just so, it's like, wow, this is nice. So that's what I like about it, for sure.
It's an added bonus because it lifts you, it repositions your skin, but it also creates collagen.
Right. And so I really like the lift. Like, I can feel like the tightness right here now. At first it used to be really loose and I could just do that. Now I can't do that. Now I'm just snatched, you guys.
That's the goal.
Right? So you guys, I'm gonna be going off the live. So if you guys have any last questions, it's almost 1 more minute. Let me know. I think it's delayed. You know how it can be delayed sometimes? And so you can't get the questions until after. Did you know the videos that you did, one of them is like 100 and I think 65K, and the other one is like A little bit over 50K now.
Really?
Yeah.
Wow.
You're a celebrity
You know,
now.
No, you. They're your followers. I'm just doing your treatment.
So I was telling them I'm probably gonna book the next treatment with the jawline. I seen that on the lady over here.
Mm-hmm.
It was so nice, you guys. I can't wait. Somebody told me to do it too. So yeah, I'm thinking about that. You guys, it's 30 minutes, so I'm gonna talk to you guys later. If there's no last questions, I'm gonna go ahead and get off and talk to you guys later. I have a new video coming out, by the way. It's the butt injection. She actually did it. So, can you tell them a little bit about the butt injections a little bit?
So what we used was hyperdiluted radius, and what we're trying to accomplish again is collagen stimulation. Whatever area we have a little divot or imperfection, or if we just want to create volume, wherever we place the hyperdiluted radius, it's going to create collagen 1 and 3. So we generally put in a certain amount of vials or syringes, and we wait about 5 to 6 weeks, and we reevaluate the tissue to see how much collagen was created with that amount, and then we retreat the area until the patient is satisfied. And whether, again, it's just little indentations from cellulite or hip dips, or the person just wants a little bit more volume at a certain area because they feel like they're a little deficient there, then that's where we focus our product.
So with the product, is it dissolvable or does it dissolve or anything? Is there anything to worry about as far as dissolving?
It does not dissolve.
Okay.
The collagen that's stimulated doesn't go anywhere. Naturally, as we age, gravity pulls the beauty down. So we have to sometimes put a little bit in there just to kind of prick it up again.
Yeah.
But whatever collagen stimulated, it doesn't go anywhere. It's not just like a filler that your body's going to break down in time.
Okay, so it's not dissolvable because somebody had asked me that. Is that because they seen a little clip and they said, well, is that the same thing that's being put in your under eyes and stuff? Does it dissolve? And
So some clinics do use HAs, the hyaluronic acid fillers. We choose not to because we want to use something that's going to create collagen for the patient. So most often we use Sculptra or hyperdiluted radius because we do want to do something that's going to be more long-term for the patient.
Right.
If you're just trying to create volume and immediate results, you can do or hyaluronic acid, but that's not our go-to for our personal preference at our clinic.
Right. So yeah, you guys are gonna be seeing that video dropping like in a week. I have to finish editing some things because YouTube doesn't like butts all over your screens, you know? So I had to do a lot of like editing and probably a little voiceovers just because of the type of film it is, you know? So I don't know how YouTube is gonna take that once I drop that video, but I am gonna upload it even if it gets flagged. Okay, you guys, I'm about to go ahead and go. I'll talk to you guys later. Bye.